Backbone pain relief for seniors over 60. Backbone pain is one of the most common health problems affecting people over the age of 60, and it has become a growing concern as life expectancy increases and more seniors strive to remain active and independent. As the years go by, the human body naturally undergoes a process of gradual wear and tear that affects nearly every system, but the spine, being the central pillar of support for the entire body, bears the greatest burden. The bones, once strong and dense, begin to lose their mineral content and become more brittle, increasing the risk of minor fractures and chronic discomfort. The muscles surrounding the spine also weaken over time, losing their tone and elasticity, which makes it harder to maintain good posture and balance. The joints that used to move freely start to stiffen due to reduced lubrication and cartilage wear, leading to limitations in flexibility and mobility. The discs between the vertebrae, which act as cushions, slowly lose their water content and elasticity, becoming thinner and less effective at absorbing shocks from everyday movements. These changes combined make the spine more vulnerable to strain, injury, and degeneration, resulting in pain that may range from mild stiffness in the morning to severe, persistent discomfort that interferes with daily life. For many older adults, this pain can affect not only physical health but also emotional well-being, independence, and quality of life. Tasks that were once simple, like bending, walking, or even sitting comfortably, can become difficult or painful. Some people experience dull, aching pain in the lower back, while others may feel sharp or shooting sensations that travel down the legs, often due to nerve compression. Spinal conditions such as arthritis, osteoporosis, spinal stenosis, or degenerative disc disease often develop silently over the years, showing symptoms only when the damage has already progressed. The combination of reduced muscle strength, slower healing, and structural wear can make recovery more challenging for seniors compared to younger individuals. However, it is important to remember that while aging plays a major role, back pain is not an inevitable part of growing older. Through proper care, exercise, nutrition, and posture habits, many people over 60 continue to live active, comfortable, and fulfilling lives despite spinal changes. Regular physical activity helps maintain flexibility and keeps the muscles supporting the spine strong and stable. Balanced nutrition rich in calcium, vitamin D, and magnesium supports bone health, while staying hydrated keeps spinal discs supple. Good posture when sitting, standing, and sleeping prevents unnecessary strain on the lower back and neck. Maintaining a healthy weight also reduces stress on the spine, as even a few extra pounds can increase pressure on the lower back. In many cases, a consistent routine of gentle movement and mindful self-care can prevent pain from worsening, and even reverse some of its effects. While aging cannot be stopped, the effects of aging on the spine can be managed and minimized. With attention, patience, and daily effort, seniors can protect their backs, improve mobility, and continue enjoying life with confidence and comfort. The key is to stay proactive rather than reactive, to strengthen the body before pain becomes disabling. Back health, like all aspects of wellness, depends on steady, lifelong maintenance. Every small action, from stretching in the morning to choosing supportive seating or walking daily, contributes to a stronger, healthier spine. Even after 60, it is entirely possible to move freely, live energetically, and age gracefully without being held back by back pain. For many older adults, this pain can affect not only physical health but also emotional well-being, independence, and quality of life. Tasks that were once simple, like bending, walking, or even sitting comfortably, can become difficult or painful. Some people experience dull, aching pain in the lower back, while others may feel sharp or shooting sen over time. The discs between the vertebrae lose fluid and elasticity, the ligaments become less flexible, and the muscles that stabilize the back may weaken if not used regularly. All these factors together make older adults more prone to experiencing stiffness, soreness, and sometimes even chronic or severe back pain. However, back pain in old age does not mean that one must live in discomfort or give up an active lifestyle. While it is true that the spine becomes more delicate with time, there are countless ways to keep it strong, flexible, and pain-free. Through proper posture, regular low-impact exercise, a balanced diet rich in bone-supporting nutrients, and some simple daily habits, it is possible to significantly reduce pain and improve overall spinal health. Many seniors in the United States have successfully managed or even reversed years of back pain by making small yet consistent changes in their everyday routines to understand how to prevent or treat back pain effectively. It helps to first know why it happens. There are many possible causes. In some individuals, it stems from muscle, strain or ligament tension due to years of lifting objects improperly or sitting in poor posture. In others, the problem may be deeper. Conditions such as arthritis, degenerative disc disease, or spinal stenosis can lead to nerve compression, causing pain that radiates from the lower back down the legs. Osteoporosis, a condition in which bones become brittle and fragile, is also a common contributor to spinal pain in seniors, particularly in women. Even a small fall or sudden twist can cause a fracture or compression in the vertebrae when the bones are weak. It is therefore essential for older adults to maintain bone strength and protect their backs from unnecessary strain. Posture is one of the simplest yet most powerful tools in reducing back pain. Over decades of sitting, working, or walking, many people develop habits that are harmful to their spine. For example, slouching forward while sitting or leaning on one leg while standing can cause uneven pressure on the back muscles and spinal discs. Seniors should focus on sitting in chairs that support the lower back, keeping both feet flat on the ground, and avoiding soft couches that cause the body to sink. A small cushion placed behind the lower spine can help maintain its natural curve. When standing, it is important to distribute body weight evenly across both feet. Pull the shoulders slightly back, and tuck the chin in just enough to keep the head aligned with the spine. These small adjustments might feel awkward at first, but over time they can relieve a surprising amount of pressure and pain. In addition to posture, gentle movement is crucial for keeping the spine healthy. Many seniors mistakenly believe that they should rest completely when their back hurts, but in most cases, too much rest can make the problem worse. Lack of movement weakens the muscles that support the spine and causes stiffness in the joints. Regular, low-impact exercise is one of the best long-term solutions for reducing back pain. Activities like walking, swimming, or practicing gentle yoga are ideal for older adults. Walking improves circulation and strengthens the muscles in the legs and lower back. Swimming or water aerobics is especially beneficial because the buoyancy of the water supports the body, allowing free movement without putting stress on the joints. Yoga, when practiced carefully, helps stretch tight muscles and restore flexibility to the spine. Simple poses such as the cat-cow, stretch, or child's pose can loosen up stiff back muscles and improve posture. Of course, exercise must always be approached with care. Seniors should consult a healthcare provider or physical therapist before starting a new activity, especially if they already have arthritis, osteoporosis, or other chronic conditions. Many people underestimate how much food choices impact back pain and bone strength. The spine is made of living tissue that constantly regenerates and repairs itself, and this process relies heavily on essential nutrients. Proper nutrition supports the bones, discs, muscles, and nerves that keep the back strong and flexible. Without the right vitamins and minerals, the spine can become weaker, more inflamed, and more susceptible to injury. A diet rich in calcium, vitamin D, magnesium, and omega-3 fatty acids provides the foundation for spinal wellness. These nutrients not only help build and maintain bone density, but also reduce inflammation that can aggravate pain. Eating fresh fruits, vegetables, whole grains, and lean proteins keeps the body nourished, while staying hydrated ensures that spinal discs remain soft and cushioned. What we eat truly shapes how well our bodies age, and the spine, as the body's core support system, depends on daily nourishment to stay strong, resilient, and pain-free. The spine, like all parts of the body, depends on the nutrients we eat to maintain its structure and function. Calcium is vital for keeping bones strong, and vitamin D helps the body absorb calcium effectively. Both of these nutrients can be obtained from dairy products, leafy green vegetables, and sunlight exposure. Magnesium supports muscle and nerve function, and can be found in nuts, seeds, and whole grains. Omega-3 fatty acids, commonly found in fish like salmon and tuna, help reduce inflammation, which can be a major cause of back pain. Staying hydrated is also critical. The discs between the vertebrae are mostly made of water, and dehydration can cause them to shrink and lose their cushioning ability. Drinking 6 to 8 glasses of water a day helps maintain spinal flexibility. Maintaining a healthy weight is another key factor in relieving pressure on the back Extra body weight, especially around the abdomen, shifts the body's balance forward and puts strain on the lower back. Seniors who lose even a small amount of excess weight often notice a significant improvement in back comfort. A combination of light exercise and a balanced diet rich in fruits, vegetables, lean proteins, and healthy fats can support both weight control and spinal strength. 4. Those who experience persistent or severe back pain, professional help may be necessary. Physical therapy is one of the most effective treatments available for seniors. A physical therapist can teach exercises that strengthen the core muscles supporting the spine and improve flexibility. These sessions also help correct posture and teach safe movement patterns for daily activities such as bending, lifting, or standing. Massage therapy can also be highly beneficial. It promotes blood circulation, releases muscle tension, and improves overall relaxation. Some seniors also consider chiropractic adjustments, but these should always be performed by a licensed professional and only after consulting a doctor, particularly for individuals with fragile bones. Sleep quality greatly influences back health as well. Many seniors wake up with stiffness or pain simply because of poor sleeping posture or an unsupportive mattress. A medium firm mattress is generally best for maintaining proper spinal alignment. Sleeping on the back with a pillow under the knees helps keep the natural curve of the spine, while side sleepers can place a pillow between their knees to reduce hip strain. Sleeping on the stomach should be avoided, as it twists the spine and strains the neck.
Getting adequate sleep
Not only relieves pain but also allows the body to heal and regenerate. In some cases, medical treatments may be required. Doctors may recommend anti-inflammatory medications or muscle relaxants to manage pain. If the discomfort is related to nerve compression or arthritis, corticosteroid injections may provide temporary relief. Surgery is usually considered only when other methods fail and the pain severely limits mobility or quality of life. Thankfully, most seniors do not require surgery and can achieve significant improvement through consistent self-care and physical therapy. Beyond physical remedies, mental and emotional well-being play a huge role in managing back pain. Chronic pain can sometimes lead to frustration, anxiety, or even depression. Staying positive and mentally active can make a big difference. Engaging in social activities, pursuing hobbies, or joining senior exercise classes not only keeps the body moving but also boosts mood and motivation. Practices like deep breathing, meditation, and mindfulness can help calm the nervous system and reduce the perception of pain. Stress often causes muscles to tighten, particularly in the neck and back. So learning to relax both the body and the mind is an essential part of recovery. Ultimately, managing back pain is not about a single cure, but about developing a lifestyle that supports the spine every day. It's about movement, nutrition, posture, sleep, and mindset working together in balance. Even small habits such as sitting upright, taking a short walk after meals, or stretching gently before bed can have long-term benefits. Consistency is key. The more regularly these habits are practiced, the more effective they become. Back pain might be common in older adults, but it is not something that must define life after 60. With awareness and proactive care, it's entirely possible to maintain strength, flexibility, and comfort. Many seniors who once struggled to stand or walk for long periods have regained their confidence and independence by making simple changes to their routine. The goal is not just to relieve pain temporarily, but to build a foundation for lifelong spinal health. A healthy spine means more than just freedom from discomfort. It represents independence, energy, and the ability to live life fully.
Taking the time each day to care for your back.
Move your body, nourish yourself with the right foods, and rest properly is an investment in your overall well-being. Whether it's through gentle exercise, better posture, mindful relaxation, or professional guidance, every effort brings you closer to a stronger, pain-free, and more active life. Growing older does not have to mean slowing down. With the right approach, your golden years can be a time of strength, mobility, and true comfort.